Uh, well, good evening, Mayor Pro Tem and council members. As you'll recall, we've moved our updates on COVID-19 to every other week. So this is a chance for us to catch you up on what's been happening the past 2 weeks, and we'll be providing an update to council tomorrow as well. Joining me today, I'm Jason Belling, Director of Public Health. Our Deb Federspiel, our Deputy Director, Sarah Mock, who oversees our health planning, data and communications, and Helene Lenzer, who oversees our community health nursing. So Sarah, if we could dive in. So as far as the change we've seen, and recall this is a 14-day change, this new table, we've seen 38 additional cases, 2 additional hospitalizations, thankfully no deaths, and our 1-week average positivity decreased, by 1%. Next slide. And again, we're just tracking where we're at, where we're in level clear, and you can see we're doing fantastic when it comes to our snapback measure for hospitalizations. Next slide. As far as what's happening statewide is we're seeing a same trend that's happening across the United States, that hospitalizations and deaths are decreasing. What we are seeing, though, is a rapid increase in the Delta variant, or the B.1.617 variant. It is now beginning to overtake the B.1.1.7 variant in certain states. We're starting to see an increase nationally, and then I'll talk specifically, we're seeing an increase here in Colorado. It's been now identified as a variant of concern, and I'll talk about why on the next slide. We don't have any of these variant cases specifically in Broomfield. That being said, again, we're seeing it spread nationally and here in Colorado. My assumption is we are seeing some of the B.1.1.7 spread in the Denver metro region, and that would potentially include Broomfield. As far as vaccine breakthrough cases or the observed vaccine effectiveness, we're still seeing that the vaccine is working, and I'll talk about that in more detail on the next slide. You can see where we're at as far as in Broomfield. Thankfully, due to our vaccine numbers, we're still in a sustained decline for incidence. Our 7-day incidence rate is 21.2. Our current positivity rate is 1.4. And of note is our incidence is highest, our case incidence among the 10 to 19-year-olds so far in June. And that was compared to the 20 to 29-year-olds in May. That's somewhat to be expected, though, because 10 to 12-year-olds are not eligible for the vaccine yet, and 12 to 15-year-olds became eligible in that month. And then you can see as far as where we are at with variant cases. So next slide. So this is what I was alluding to about the Delta variant. The reason this variant is of concern, both to the CDC and leading public health experts, is its rapid increase in prevalence. It has a higher transmissibility. It's 50% more transmissible than the B.1.1.7 variant. And this is often the variant they refer to as the Indian variant that took hold in India, and we saw it spread so quickly. Also, what was seen, we're learning from national or international data, is hospitalization risk is double. And that was specifically from UK data. So we know it's more transmissible, and that we know that it's potentially more severe. As far as the status in Colorado, again, we do sampling of the cases, and then we look at specific sequencing of those sequencing results that came back. 40% of them, of the variants, were from this Delta variant. Some good news, though, is we know the vaccine works. So if you have been vaccinated, specifically been fully vaccinated, we're finding it's still 88% effective against protecting you from this variant. However, though, if you've only received one dose, it's only 33% effective. And if you're unvaccinated, again, your risk of both contracting COVID or potentially having severe COVID disease or hospitalization definitely increases. So next slide. Other big news that's happening this week is the Advisory Committee on Immunization Practices is scheduled to meet. They were going to meet last Friday, and due to the federal declaration of the federal holiday, Juneteenth, they postponed that to June 23rd. What they're going to be talking about is providing an update on the COVID vaccine safety, specifically looking at the myocarditis and the mRNA vaccines. They're also going to dive deeper into the mRNA vaccines in adolescents and young adults and have a benefit risk discussion as far as what they're seeing from the data. And then they're going to provide an overview of data to inform recommendations for additional doses of COVID vaccine, or what people often refer to as the booster shots. And so determining what data they will be reviewing and looking at as the advisory committee makes those recommendations. Next slide. So as far as Broomfield's population that's vaccinated, you can see we had already exceeded our threshold of those that had at least had received one dose of the COVID vaccine, but we're very close with 72% of our population that have completed their vaccines or are fully vaccinated, of reaching that 75% threshold, which is great news. We are starting to see some leveling out of the vaccine uptake, as would be expected. We are still seeing increases in the 12 to 15-year-old age group, but still more work for us to do. And now we're getting to the point where we have to specifically find those individuals that are unvaccinated, and it's not so much population-based interventions, but more targeted interventions of going out and bringing the vaccine to where people are at. So we'll continue to do those targeted efforts in Broomfield Public Health. Next slide. And this just further illustrates what I was talking about as far as the breakdown of percent vaccinated by age group. And so thankfully, we're seeing that 12 to 15-year-old age group going up. Our 16 to 19-year-olds are at 70%. And those two age groups are extremely important as we're starting to think about the fall school session and planning for that, of what that's going to potentially look like. And would strongly recommend that all parents get their kids vaccinated leading up to the next school session. And then of concern, though, is that 20 to 29-year-old age group and the 30 to 39. We'd still like to see those numbers go up, because as we had saw before with the B117 and now with the Delta variant, we're seeing hospitalizations occur in younger age groups. So it's no longer just occurring in those 65 and plus. Next slide. And this just gives you a further breakdown of cases that we've seen, both from May moving to June. The good news is what we're seeing is cases are definitely trending downward, even though this is a snapshot halfway through the month. That's what we want to see. And what you can, again, see with the June data is that the 20 to 29-year-old age group and the 30 to 39 ones are the ones that we're concerned about. We did see a big drop from May, and we hope that this continues in June for the 10 to 19-year-olds. So we'll see how that progresses. Next slide. And just as a reminder, Broomfield, along with the other Metro counties are still under a public health order. We're in level clear, and that will continue through August 16th. And another reminder is we have the statewide public health order that is requires face coverings for those 12 plus olders who are not fully vaccinated in specific settings. We'll find out if the governor plans to extend that order or let it expire leading up to July 1st. And I believe that's our last slide. So with that, I'll turn it over to council members that may have questions. And again, we have our experts on the call too, if you have specific questions, either about the variant or about any of the vaccines. Councilmember Schaaf. You're on mute, Councilmember Schaaf, or we can't hear you.
Can you hear me now?
Yes, yeah.
Perfect. Thanks for the presentation, Mr. Valling, and this is a lot of great news. There are some things that I do have questions about that I just wanted to get clarification on. In the past, we have seen a cases chart that also had a kind of a line with it for cases for people that have been vaccinated. Do we still have that data, and are we still producing that? I didn't see that in your slideshow, and I didn't see that on the website.
Yeah, thank you, Councilmember Schaaf. That was data that we presented from the state. We do still have that data, so we can show what's happening statewide as far as cases, again, with those that are unvaccinated versus those that are vaccinated. What we're seeing is extremely low case rates and hospitalizations in the vaccinated group.
Okay, I mean, that's been great information for me to be able to share to folks that are kind of hesitant about whether or not to get the vaccine, is showing them that data and saying, look, here's the difference. This line of cases or people that aren't vaccinated, and they're moving up, and here's the line of people with here are the number of cases for people that are vaccinated, and that's that big red line that just sits there at the bottom, and that's been great. So I would love to see that. If you can send me a link to that for the state side, that would be great. Or share that in the future, that would be awesome. Another question I had was with regard to the deaths. In terms of on our website, we have the deaths in the region. So I know that Broomfield is very low, and it's been low for almost a month now. I think it's 0 for almost a month now. But in the region, there's still some death rate cases, and it almost looks like that while we've kind of come down significantly from, I believe it was this last fall, in terms of when we had a really high death case number, it's almost kind of returned to that last summer's levels as well. And so I was curious about that. That basically, I would expect that we had more plummeted beyond that, whereas last summer we didn't have a vaccine in place, and the numbers were basically on par for where we are now. Could you give me any information on why we're seeing that still kind of trending death rate at this point?
Yeah, that's an excellent question. I'm actually going to have to dive into that data a little bit further to look at it. My understanding is we did start to see deaths decrease as sort of that lagging measure statewide and in the metro region, just as we did with hospitalizations and cases. As far as comparing it to last summer's death rates, I'd like to see where those two numbers are at, Councilmember Schaaf, and so I could give you more of an informed answer. I think the two things I would offer up is, again, we are seeing some of these variants pop up that are more severe than the initial wild strain or type A strain that we had out there. And then the second thing is we're seeing some relaxation of our public health orders and mitigation efforts, and that's leading to more people mixing together. And so if you have unvaccinated individuals who, again, may be contracting the more severe virus could lead to increased consequences, both hospitalizations and deaths. But I'd like to look at that more closely.
Okay,
and Helene
yeah.
or Sarah, I don't know if you guys have anything to add to that. Okay.
Well, and that brings up something I'll take a look at too, is kind of where those deaths are in terms of age range, because I'm hoping that we aren't basically going back to the beginning where the older populations are the ones that is where our death rate is, and these new variants are now affecting the population that we took care of for so long. So I'll take a look at that as well. The next piece was the on the variants, the Delta variant, seeing that was 88% effective. That's still pretty good, I think, in terms of vaccines. So that gives me a good feeling, but it is down about 10 percentage points from the effectiveness that we first learned about with that. So at this point, are there any mitigation recommendations that public health has as this variant continues to become more widespread? And I mean, from the data, it's now 50% of the cases.
The best mitigation strategy that we have right now is vaccines.
Okay.
We're strongly encouraging everybody that's unvaccinated to get a vaccine. We know they're safe and they're effective against the variants that are out there, and specifically this one. The second thing is, again, if you're not eligible for a vaccine, which is mainly our children, making sure that we keep those public health mitigation efforts in place. And we're still working very closely with our child care facilities, the schools for summer camps, all of those specific settings, so that we do keep those public health measures going.
Great. And then the last thing, is kind of stemming from vaccines, but the myocarditis. This is something that we're learning about. I'm just learning to say the word myocarditis. But what are those symptoms that we're seeing post-vaccine with regard to that? How would someone know that was what was going on as opposed to something else?
Yeah, I'll let Helene take this one since she's often advising people that are getting the vaccine.
So they're definitely, can you hear me? Yeah. There's definitely things, they're looking at some of the cases that seem to be 30 and under. So I'm not sure that it's necessarily something impacting all age groups, and it's still a small number, but it is still something that they're looking into more. So just, again, in the blanket of just unusual symptoms, post vaccination. So if they had some kind of chest pain, some kind of shortness of breath, things that would be, out of the norm of, just within, the first 24 to maybe 72 or so hours after the vaccination. So it's still small numbers that we're seeing that they're monitoring, but nonetheless, I know the ACIP is going to be kind of looking into that more. Just the advisory committee for the immunizations will be looking kind of into that more when they meet as well.
So with this, I mean, you were talking about the 24 to 48 hours, post-vaccine. So this isn't something, that someone's going to see a week or a month or, a couple months down the road.
I think, again, I think they're still studying it more. So I think that this is something, the myocarditis, the pericarditis, that's something that seems to be coming up within a few weeks or so after the vaccination. But I think that's part of what's going to be discussed further, just to kind of more analyze the data that they've compiled so far. Okay, well, I look forward to hearing that update from you all, or from the group that is looking at this. So thank you again for the presentations. That's all the questions I have today.
Thanks, Councilmember Schaaf. Councilmember Lim.
On the vaccine percentage numbers for the 12 to 15-year-olds, you said, I think I noted it's like 58%. And you also noted that obviously the big push is so there's a larger percentage vaccinated before the school year starts. But maybe it's just what I would be like if I had a child in that age group. They're mixing on the playground, they're mixing in summer camp. I would already be concerned as a parent to get this age group vaccinated as soon as possible. So thinking from that perspective, do we have any indication that there's a hesitation or some obstacle for, parents in that age group that we could address in any way? Or is it just, they're all kind of just wait and see, we can get it done before the school year starts?
Actually, I think we saw a initial, actually there was quite a bit of demand when the vaccine first came out for that 12 to 15-year-olds. We're still seeing that demand there. It hasn't totally tapered off. Where I was going with my comment, Councilmember Lim, is from a school-based perspective. If we could get to the place where we have high vaccination rates in the community, low community transmission, and high vaccination rates among the student population, that then could let us hopefully not have as many of the mitigation tools or orders in place that we had in the past. Specifically when you're talking about quarantines and kids that are out for 10 to 14 days of school, it impacts other aspects of their social emotional health. And so given that we do have a highly effective vaccine, you're exactly right. As a parent, I would be encouraging all parents to consider getting the vaccine for their children right now. And all of the data that we know at this point is that it's both safe and effective. And the CDC is continuing to state that, even though the Advisory Committee on Immunization Practice is looking specifically at the myocarditis.
And if there were any outbreaks in summer camps or something, I guess we would see that data just like we used to see outbreak data. We would have that information also.
Go ahead, Helene.
To answer your question, yes, yeah, we would be watching that for sure on like the schools teams and any of the camps, and so definitely monitoring that along the whole state, and in our county as well. Yeah, so I was going to say something else and now it just left my head. Sorry.
I think it was the question: are we seeing lower demand for the vaccine with the parents?
Oh yeah, sorry, thanks. I'm like, I had something I was gonna say. Sorry. It was just in the realm of just in terms of trying to increase that awareness and education and be able to answer questions for parents. This statewide, I would say we're definitely have a push to help providers, more PCP offices, more general practice offices have access to the vaccine. So I know they're allowing the Pfizer vaccine to be from the state, like allocation is in smaller doses to help encourage other providers, other practices to also be able to offer it and answer questions. So I think we're trying to hit it on multiple fronts is kind of where I'm coming from, is just that trying to get more providers involved in the vaccination efforts and answer more parents' questions to help get that age group vaccinated.
That's great. Yeah, I would think that would be the obvious point if I were, a parent with that age child, to call my provider. So yeah, if there's some obstacles to those smaller doses getting to the provider, then that seems like a big effort, big important effort to provide it to the children. Okay, thank you.
Thanks, Councilmember Lim. Councilmember Anderson.
Thank you. I have just a couple questions, and the first one is kind of along the lines we've talked about before, is trying to get these vaccine rates up to above that 75%. Is it, from your perspective, what you're seeing, is it more of like a vaccine hesitancy? Because I'm hearing people say there hasn't been enough testing yet. I don't know it's safe. Even though we have so many people that are vaccinated, or is it that we're not reaching people? Do we have a feel for, or is it kind of a combination of both? Like, is it more along the lines of convincing people that this is an okay thing to do, and the benefit?
Yeah, it's an excellent question, Councilmember Anderson, and it evolves too as we move through the vaccine effort. I think we still are at that point that there are certain populations that are waiting to see with the vaccine. Specifically, what we most often hear concerns around the side effects and the potential impact on being able to go to work the next day. Convenience is a big thing. So if we can bring the vaccine out to specific work sites, again, for that 20 to 29-year-old age group, we found that has been effective. But we also are finding that, and I think you're seeing this sort of trend in the state, that certain counties, both rural counties and political affiliation, are also unfortunately playing into this, and we're seeing lower vaccine rates in some of those counties. But in Broomfield specifically, I believe I addressed most of the feedback that we've heard. And I would say lastly, with our Latinx community, specifically our undocumented community, there is a concern of getting vaccinated and having to provide information and where that information would go and how it would be used. So overcoming that barrier as well.
Thank you for that. And I share that concern with the documentation. So whatever we can do to help is great. And then is there any, like right now, if you're in Broomfield and you're surrounded by we have such a low rate, and you can kind of feel safe here, but as soon as people are traveling, and I mean, are we getting the message out enough that, you might feel safe here, but it's that you're moving into counties as you're traveling across Colorado and beyond, where it's less than 50%, and that you don't have that without being vaccinated. Like we still have a young child under 12 who can't be vaccinated, and that's going to be part of our summer vacation plan. Is that we're hesitant to, I guess that'd be another question. When you have a child under 12 who can't be vaccinated, can you go to water parks and feel safe? I mean, beyond the bay, like bigger parks or Litch Gardens or some amusement parks. Is that museums? I mean, are these safe things for families to do now, in your opinion, or is it with a mask on, or is it? That'd be interesting to hear some thoughts on that too, and also just how do we get that message out that be careful as you travel?
Yeah, excellent question. So as far as traveling, one thing we're trying to emphasize is we're definitely not out of this pandemic yet. So while Broomfield's doing excellent with our vaccine rates and community transmission, what we know is exactly to your point, if you're traveling to a certain location, I would strongly encourage looking up what's the community case rates there. If you do have individuals in your family, both children or adults that are unvaccinated, continue to follow the CDC guidance, which is wearing a mask, social distancing, and washing hands. And then specifically to your point of, is it safe to go to specific places? We often send or refer people to that CDC graph that talks about low risk and high risk activities. And specifically if you're unvaccinated versus vaccinated, what you need to do. And I would say for the vast majority of them, masks are required or recommended if you're unvaccinated. What we also know though is indoor transmission versus outdoor transmission is very different. So higher risk settings are if you're unvaccinated with other unvaccinated individuals in an indoor setting, higher likelihood that you would be able to contract it. And the last thing I would just say too is we're looking at where we're at in this pandemic. As the United States and Colorado and Broomfield, we're doing really well and progressing really well. We're seeing our vaccine rates go up. We're seeing some of our mitigation efforts being able to be relaxed. But what we do know is this virus, when it gets to unvaccinated individuals, it's looking for that host. And then there's that potential as it transmits among unvaccinated people, either in Broomfield, Colorado, the United States, or in the whole world. There's the potential for additional mutations and additional variants. And that's the concern of public health, is we could see continued spread, and then will the variants at a point become to a place that the vaccines aren't as effective against them. So it's just always keeping our eye on the ball and what's happening both internationally here in the United States and in Colorado and Broomfield, so that we're tracking those variants and are very aware of the potential impact.
Thank you.
Thanks, Councilmember Anderson. I believe I see any other hands. So with that, that concludes the presentation. Again, want to thank this council for being so engaged and asking such insightful questions. I often bring your questions back to the State Health Department to get answers. So that just shows how educated you guys are on this issue, and I appreciate that. And we'll see you tomorrow at City Council chambers. Have a great Monday night.
Thank you,
You guys too. Thank you very much.
Bye.